Since 1985, the Pan American Health Organization has opened its doors to young professionals on the health sector to have the opportunity to work on different programs and areas in the field of public health. The Canadian Young Professionals Program at the Pan American Health Organization started just 11 years ago in June of 1997. Since then, PAHO has had the opportunity to place 75 to 100 Canadians at PAHO headquarters and country offices. They have worked in areas ranging from mental health, workers' health, HIV/AIDS, veterinary public health, social communication, and knowledge management, among other areas of the organization. Young Canadian professionals have been assigned to work in many country offices and centers such as Brazil, Panama, Honduras, Ecuador, and PANAFTOSA, the Pan American Center for Foot and Mouth Disease. Many have received contracts to stay at PAHO once their placements ended. One example of this is Ms. Marie-Claude Lavoie, who has been working with PAHO since 2007.
In 2006, I was just finishing my master in public health, and I was very interested to work in international health. So I was searching different opportunity, and that's when I find out more about the Canadian program. It was offered by the Canadian Society for International Health, and they were offering placement for young professionals in international organizations and overseas. And then they had an opportunity to enter at PAHO, so that's how I heard about this. So I applied to the program, and then I began my 6-month placement at PAHO in 2007.
Young Canadian professionals are typically recent graduate students or about to graduate. These young professionals benefit from significant work experience in an international context through 6 to 12-month placements.
So I started in 2007, and my placement was in the Sustainable Development and Environmental Health, more precisely to Workers' Health Program. And that was a perfect match for me because I used to work as an occupational therapist in the past, and I studied in public health and had some focus on occupational and environmental health.
The experience and skills gained through these placements strengthen the young Canadians' employability and increase their chances of finding stable employment, whether in Canada or abroad, in their own area of specialization. The Young Professionals Program has also provided the Pan American Health Organization with fresh perspectives, talents, and skills that have been honed within the Canadian educational system.
Several factors made my experience successful. First, the Canadian Society for International Health program, through which I had my placement. They provided me with a lot of support. Before the placement, I had an orientation, and I had the chance to learn more about PAHO, as well as Canada's role in the region. And during that time, I was able to meet with governmental representatives. I met people from Health Canada, as well as the Public Health Agency of Canada. And then when I arrived here at PAHO, it was a very supportive environment. So there was the PAHO internship program, which provides excellent orientation to PAHO as well as other international organizations in Washington.
Young Canadians have contributed much to PAHO's work, such as mapping current health services in Honduras pertaining to HIV/AIDS, developing and promoting food safety programs in Brazil, providing key technical support and training on the implementation of information systems applications, including the training of field office staff in the Caribbean region, among others.
We work in close collaboration with the project in Ecuador, focusing on healthcare workers, as well as the one in Trinidad and Tobago. And with the National Institute for Occupational Health and Safety in the U.S., we had projects in Venezuela as well as Colombia.
PAHO would like to continue placing young Canadian professionals for many years to come. The goal of the Canadian program is a mutually beneficial one that provides opportunities to young Canadians to work within the many areas of public health affecting the region of the Americas. and provides PAHO with fresh talent and skills.
I think it's a very unique opportunity for Canadians to come and complete an internship at PAHO. They learn more about the region, what are the public health issues, the solution, and as well as they learn more about the Canadian involvement within the region.